Hi, my name is Bill Darzik. I'm the CEO of Fox Run Orchard Park. Today is Wednesday, September 15th, and this is our, hopefully, temporary stretch of weekly COVID updates. I want to start by thanking our esteemed production crew, Melissa Matlack, for getting this up and running. We had some technical difficulties already today. Just when you think things are running smoothly, something happens, and I think that's no different with our COVID update. So last week I reported that we had a number of cases, and that number has grown a bit. So I'll start with our numbers. Currently we have 13 residents in our skilled nursing unit that are positive for COVID-19, and we have 10 staff members in the health center that are also positive. So I'll start with our residents. All 13, I will say, are all fully vaccinated, because I've said in the past we're 99% vaccinated. And there's kind of a boundary somewhere between, do I give information, what can I share with regards to HIPAA and privacy rules, but all are fully vaccinated, all of our residents. One of the questions I got from a family member is, how can this happen? How is it possible that you tell us we're 99% vaccinated throughout our campus, and yet we have 13 cases? Could they all possibly be breakout cases? And the answer is yes. So the vaccine does protect us. It does limit the ability of the virus to enter our bodies, but it does happen. The good news is those community members who are all positive, 10 of those are completely asymptomatic. They have no symptoms. And the 3 that do have symptoms are all minor symptoms. So what's a minor symptom? An example would be a runny nose, sniffles, or a minor cough. So our residents are all doing very well who have COVID, and in accordance with Department of Health regulations, we have segregated our skilled nursing unit into zones. The yellow zone is an area where residents are not positive. They do not have the virus. And then there's red zones where we're able to keep all of those positive residents together. We had to do some room shuffling, and of course with that, there's a whole new protocol for our staff. We're cleaning every day, sanitizing surfaces, even just going through and hitting areas where no one has even been. We're going to continue to do those on a regular basis, on hourly or 2-hour basis. All of our staff are all wearing masks, as they have been all along, but they're wearing eye protectant, so shields, and everyone who spends time in the health center has to wear a gown. So yours truly, as I go up to see how staff are doing, I'll gown up because that's part of the protocol. So I assure you we're doing everything we can to keep this thing at bay. It is unusual to see that we have 10 cases and then we test everyone the next day, and then there's one more, and then the next time we test there's one more. So it could just be a delay in when that person does show up as a positive. We're not exactly sure, but our hope is that it has stopped and that our resident cases will start to go down over a period of time. So the protocol is that weekly we are testing any residents who are negative, and our testing our next round will be tomorrow. So any of those residents that are currently negative will be tested again tomorrow, and that'll continue until we get past a 14-day period of the last known case. So we'll go through this for another couple more weeks, and then I'll continue to do these updates every week until it's gone. As for our 10 staff, and that one's a little different. I can't really comment on vaccination status. I do believe everyone is doing well, but people are at home quarantining, so we're not seeing them every day and being able to check on them every day. So we just go with what they're telling us. And with that, it's a little tricky because we've had staff members who haven't been here in the past week or so, or have been on vacation and are testing positive, and therefore we have to report them as one of our cases anyway, even though it came from somewhere else and they were actually not on site. So there's a mix of people who were here and people who weren't in that number of 10. But again, the same protocols follow. Anyone who's working with them, we follow up to see who they were with, who they spent time with, and then we continue testing some of our health center staff. And again, all unvaccinated staff will be tested as part of an ongoing protocol that was going on before we had these cases show up as positive. So I know I'm saying a lot. If there are any questions, I always recommend checking our website because this is spelled out a little better than I can do it verbally, and you'll be able to see it on our website, and that's updated every 48 hours or so. Especially in such a more fluid environment, it's updated even more often. So if we say we get another case tomorrow, the website should catch that, and you'll be able to get the information you need. So for all of our community members at Fox Run, and for all of our family members who really want to know what's going on, it's a great resource. Please check our website, which is foxrunorchardpark.com. Okay, so my next item is the vaccine mandate. Now, this is a big deal across any healthcare organization in the state of New York. So New York State mandates explains that all staff working in hospitals, nursing homes, or any other healthcare organization must have the first vaccine by one of either two dates, either September 27th, that's for hospitals and skilled nursing facilities, and then October 7th for other organizations that don't involve Fox Run. So for us, every staff member of Fox Run must have a vaccine, at least one shot by the 27th, unless they have a medical exemption by that date. Otherwise, they will no longer work at Fox Run. So what does that look like for us? Right now, we have a pretty good number of folks who are making that decision now, but we are going to lose some good people. Some people have been here for a long time, and we regret to inform you of that. We regret that they're not going to be here helping us out, but we will do the best we can to care for our community members and move forward in a positive way. So one of those, you'll see some changes over time. At the end of this broadcast, I'll come back to it, but dining services and the independent living side will see a bit of a change, and I'll explain that further. But we ask for all of your patience, knowing that we are going to lose some familiar faces, but we'll continue to do our best to fill those vacancies, which is not going to be easy. And I'm just being transparent. I just want you to know up front, it's not going to be easy to fill those positions. But we've had open interviews, and we've had people coming in a steady stream, because Fox Run is a great place to work, not just a great place to live and to be part of, but a great place to work. So I do believe it'll take some time, but we'll get those positions filled. Next item is, as I referred to in our dining venue, I had a great question from a community member saying, can you clarify what it means by the fact that we have pandemic issues, therefore the dining room will only be open certain days? Pandemic issues translate to staffing issues. So because of some of our positive cases in our health center, we've had to redeploy some of our independent living staff, specifically cooks, to go over and spend their time in our health center to cook for our health center residents. Because of the mandate, we expect to lose some of our servers who may or may not be able to get the vaccine. Some, it's not their choice. They're underage and their parents are making that choice. Whatever the reason, the concern is, how do we serve our residents? So because of staffing issues related to the pandemic, those are the pandemic concerns, we're going to be closing down the seated dining areas on Tuesday, Wednesday, and Thursday. So on Tuesday, Wednesday, and Thursday, it will be takeout or delivery only. For dinner, excuse me. And this is similar to what we had done during the height of the pandemic, where our dining venues were shut down. Here we're doing a hybrid method, and it's, again, just because of staffing. On Friday, Saturday, Sunday, and Monday, the dining room will be open, the Oak Room will be open for seated dining, so we'll be able to accommodate you. So it's not because because of the spread of the virus, it's because of staffing issues, which is why we're going with, again, this hybrid method, and our dining room is only going to be open part of the week. And finally, the last thing I'd like to touch on is the booster. I don't have much to report other than to reiterate, we do have a partnership with a local pharmacy that is willing and ready to provide us with those the next round of vaccines for the booster, and we're hoping to have a clinic. I don't know whether we're going to include that with a flu clinic in conjunction with, or just on its own, but we're still waiting for word from the Department of Health when we can go ahead and start that process. I believe they need approvals. The FDA needs to approve as well. That's right around the corner, but if I had to guess, I would tell you that somewhere in the middle of October, we should have the booster ready to deploy for anyone that needs it. And that's roughly 400 to 500 vaccines that we'll be giving out to the entire campus. Now, don't hold me to it because this is just my opinion as to when it's coming out and everything that we're told at this point. And that information is only as good as the information that we receive from those agencies. So with that, I ask everyone to continue to do your best to wash your hands, sanitize. We're not going to require residents to wear masks in the common areas, but we are strongly encouraging that you wear a mask until all of this, we get past this next hurdle. All staff must wear masks anywhere on campus, and visitation is allowed on the independent side and in assisted living in our health center. Skilled nursing is still shut down for visitation until the cases go away. And again, that's per Department of Health. But we ask that if you have any visitors on the independent side, please do not congregate in any indoor common areas. Please keep your visits to your loved one's apartment or patio home, or you can congregate outside as well. But I do encourage that you wear this mask. It's so important. And then once we get past this hurdle, hopefully we're back to where we were even a month ago. So if you have any questions, again, please check our website. And if you have anything you specifically want me to answer next Wednesday, please send an email or contact Melissa Metlack, and she can convey your questions to me, and then hopefully I can answer them on this broadcast. So with that, I hope you all have a great week, and God bless.